Hello and welcome! It's been 5 years since the world faced the outbreak of COVID-19. While we've managed to overcome that challenge, news of a new virus is now causing global concern. This virus, known as human metapneumovirus, HMPV, has recently emerged with rising cases, particularly in China, where hospitals are reportedly overwhelmed. People are once again wearing masks, and discussions about this virus have dominated news outlets worldwide. So, what's the story behind HMPV? Is it truly a new virus? What are its symptoms, and should we be worried about another global pandemic? Stay tuned as we dive into everything you need to know. And don't forget to subscribe to our channel and activate the notification bell to stay updated with our latest content. Human metapneumovirus, or HMPV, is a single-stranded RNA virus from the Pneumoviridae family. It specifically targets humans and affects the respiratory system. The symptoms are similar to the common cold or flu, including runny nose, sore throat, fever, chills, and fatigue. The virus primarily spreads through respiratory droplets produced when an infected person coughs or sneezes, as well as through direct contact with contaminated surfaces. HMPV presents symptoms that are often mistaken for other respiratory illnesses, such as cough, sore throat, runny nose or nasal congestion, sneezing, fever and chills, fatigue and body aches. For most individuals, the symptoms last about 3-6 days and resolve without medical intervention. However, the virus can become severe in certain populations. While anyone can contract HMPV, it poses the greatest threat to specific groups. Infants and young children, particularly those under 5 years old, are at high risk. Elderly individuals, especially those aged 65 and older, are also vulnerable. Immunocompromised people, including those undergoing chemotherapy or recent organ transplant recipients, are at significant risk. Individuals with chronic respiratory diseases such as asthma, COPD, or severe allergies are also at risk. In these populations, HMPV can lead to serious complications including severe pneumonia, bronchiolitis, middle ear infections, and in rare cases, life-threatening conditions. Interestingly, HMPV is not a new virus. It was first identified in 2001 by Dutch researchers who detected it in 28 children suffering from unexplained respiratory symptoms. However, further studies revealed that HMPV had been circulating undetected for at least 50 years. Why was it overlooked for so long? Its symptoms closely resemble those of other respiratory viruses, making it difficult to identify without advanced genetic testing. Unlike COVID-19, which originated from animals, HMPV has always infected humans and shows no evidence of zoonotic origins. Recent reports from China's Centers for Disease Control have highlighted a sharp rise in HMPV cases, particularly in northern provinces. Hospitals are reportedly struggling to accommodate the influx of patients presenting respiratory symptoms. What's concerning is that the number of HMPV cases in China has surpassed those of both COVID-19 and rhinovirus infections. The virus has also spread to neighboring countries such as India, Malaysia, and Kazakhstan, as well as further afield to Europe and the United States. Despite these alarming reports, experts have reassured the public that the situation remains under control. Should we be worried about HMPV? The good news is that HMPV is unlikely to lead to a global pandemic for several reasons. It's a familiar virus. Unlike COVID-19, which was new to the human immune system, HMPV has been around for decades, and many people have developed some immunity to it. Symptoms are generally mild. While it can be severe in vulnerable groups, most infections resolve without complications. Natural immunity exists. Studies suggest that many adults have been exposed to HMPV during childhood, contributing to widespread immunity. However, the virus's ability to spread rapidly in densely populated areas underscores the need for vigilance and preventive measures. How to protect yourself from HMPV. Wash your hands frequently with soap and water. Avoid close contact with individuals showing respiratory symptoms. Cover your mouth and nose when coughing or sneezing, ideally using a tissue or your elbow. Disinfect surfaces. Regularly clean commonly touched items like doorknobs, mobile phones, and countertops. Stay home if you're sick to avoid spreading the virus to others. Treatment and vaccines for HMPV. Currently, there is no specific vaccine for HMPV. Research into developing a vaccine has been limited due to the virus's relatively low profile until now. Treatment is primarily supportive and focuses on relieving symptoms. Over-the-counter fever reducers and pain relievers, cough suppressants and decongestants are commonly used. Rest and hydration are also important. In severe cases, patients may require hospitalization for oxygen therapy or other supportive measures. Could HMPV trigger a global pandemic? While HMPV is spreading rapidly in certain regions, its potential to cause a pandemic is limited. Here's why. Widespread exposure. Most people have already encountered the virus in their lifetime, leading to some level of immunity. Milder impact. Unlike COVID-19, which caused severe systemic illness, HMPV primarily affects the respiratory system and is less aggressive. Seasonal nature. HMPV infections typically peak during the winter and spring, much like other respiratory viruses. The World Health Organization has confirmed that HMPV does not currently pose a pandemic threat. However, ongoing monitoring and research are essential to ensure preparedness. Stay safe and see you in the next video.